We've had some really great successes here at White Sands Physical Therapy and Aquatics. I'm just going to tell you about one of them right now. We'll call him Charlie. Charlie, last August, was playing soccer. He's a 53-year-old man who wanted to get out there and play ball with his sons. However, when he kicked the ball, he suddenly found himself on the ground in pain that went all the way from his left hip all the way down to his left foot. The next week found Charlie at a chiropractic's office where the chiropractor used gentle techniques but had no effect. He then went to another chiropractor. This time the chiropractor used more aggressive techniques and just made it worse. He then went to standard physical therapy treatment where they tried core stabilization exercises, moist heat, electrical stimulation. None of this helped. Poor Charlie didn't know what to do, so he started to go to doctors. He went to 3 different spinal surgeons. All 3 of them told him that he needed spinal surgery. There was no other way out. 2 of those surgeons said, "This is a desperate situation. You need that surgery within the next 2 weeks." Charlie didn't have the money for surgery and didn't have insurance. He went home to ponder how he was going to find the money and maybe how he could deal with the hospital. Maybe the hospital would give him a break. During that time, he saw an ad for White Sands Physical Therapy, and he said, "What do I have to lose?" Charlie showed up at our clinic, barely able to walk in the door. He called his pain a 10 of 10, and I believe it was 10 of 10. After 13 sessions using our warm water pool with spinal decompression, using our spinal decompression machine called the VAX-D, using the exercises that we taught him in therapy, and receiving manual therapy to his back here in the clinic, he was basically pain-free. Charlie finished his therapy over 6 months ago, and I recently talked to him. Charlie says that he's still doing fine. He still uses our extension exercises that were taught in the clinic whenever he gets just a little twinge in his back or in his buttock, and he says the pain goes right away.